Meanwhile, Americans are eager to get back to work, but looming fears of a second coronavirus wave forcing much of the country now to roll back reopening plans or put it on pause. At least 15 states are pausing or delaying reopening phases right now amid a surge of new coronavirus cases. The United States is now approaching 2.6 million cases. That's up better than 40,000 overnight, leaving some hospitals strained by the resurgence. Joining me right now to talk more about that is the Health and Human Services Secretary, Alex Azar. Mr. Secretary, it's always a pleasure to see you. Thanks so much for being here this morning.
Great to see you again, Maria.
So let's talk about this resurgence and this spike that we're seeing across the country. To what do you attribute this new spike?
Well, we're seeing the surge in cases, particularly in the southeast and the southwest, and what the governors are reporting is that the majority of the new cases are under the age of 35. And so that's certainly part of it, but we're surging basically action teams into each of these communities to get better on-the-ground information, but it's clearly something to do with our behaviors is a major driver of that. And, you know, you talked about reopening. We can continue to reopen, to get back to work, get back to school, get back to health care, but we have to act responsibly as individuals if we simply do three things: practice social distancing, wear facial coverings when we can't social distance, and practice proper personal hygiene. If we do those three things, we can turn around the tide of these new cases and continue to reopen.
So you attribute these spikes to the fact that people are not following the guidelines. We're not wearing the masks. We're not social distancing. That's what you think is behind the spikes that we're seeing.
There's clearly a major element of that because we see other states and other counties that are engaged in exactly the same or even greater levels of reopening that are not seeing surges in cases. And as we talk to the governors, you know, Governor Abbott, Governor Ducey, Governor Newsom, they're seeing that some of the activities in bars and nightclubs and some outdoor activities that have people clustered together where they're not social distancing and not wearing facial covering when they can't social distance are leading to spikes in these cases.
And what do you think about those people getting it under the age of 35? I mean, initially we were told that the most vulnerable is the elderly. So what's this about?
Yeah, Maria, it's a really good point because I think a lot of the younger folks may think that they're invincible, and certainly the risks of severity or mortality are much lower for young individuals. But the challenge is you've got to assess not just your own vulnerability, but the vulnerability of those in your household, because you've got to protect anyone over 80, anyone over 65 with three of the key comorbidities. But also, what about the person next to you in line at the grocery store? You don't know whether they have a particular vulnerability. You don't know if they have diabetes and kidney failure and hypertension. You don't know that. You're putting them at risk if you act irresponsibly.
So, Secretary, the other day I was talking to a doctor, and he said to me, Maria, just so you know, I had COVID. I have the antibodies now. Should I be more worried about being with people if they have the antibodies?
No, we don't have any evidence that individuals who've recovered from COVID are any type of risk to other individuals. In fact, Maria, one of the really important advances that we've had under the president's leadership is we now are bringing therapeutics to bear. This is one of the massive changes in the last 3 months that gives us real hope as we move forward. One is Remdesivir, which is the product that that you use for patients who are hospitalized to shorten the length of stay. The other is steroids, common steroids that we've now put out treatment guidelines on. But the third is convalescent plasma. So people who have recovered from COVID can donate their plasma. That plasma can then be used as basically, think of it as an immune booster shot for individuals who are suffering from that. And we're seeing positive early results in tens of thousands of cases. We're still looking at that data. And I encourage anybody who's had COVID, contact the American Red Cross or your local blood bank, and please be a donor of plasma.
I want to get back to that because we spoke with Michael Milken this week, and he went through some of the antivirals and therapeutics. But let me ask you about Gilead Sciences, since you mentioned Remdesivir announcing its pricing plans for the first COVID-19 drug, Remdesivir. A treatment course will cost a typical patient $3,120, and that's $2,000, $340 for patients on government-sponsored insurance. This is an expensive drug. The drug maker plans to begin charging for the drug next month. What's your take on the expense? I don't think anybody realized going into this that once we do have drugs to treat COVID, that they were going to be this expensive.
Well, so we secured the donation of over 140,000 treatment courses in May and June, and we've worked with states to get that distributed where it's needed most. And now Gilead is launching the product in the commercial marketplace. And we announced yesterday that President Trump secured the commitment of 500,000 courses of Remdesivir for the United States over the next 3 months, and that will be distributed per an allocation that we will do to the states, and the states will also get it to the hospitals where it's needed most. In terms of pricing, one clarification, Maria, the patient is very unlikely to bear the cost of this, given that this is an inpatient drug. You're in the hospital. The hospital is getting a payment for your inpatient visit. They buy that drug and supply that to you out of their pocket. And if it delivers this 1/3 of shorter hospital stay that is shown in the data, then that might actually be a beneficial financial move for the hospitals there in terms of paying for the drug, but then having the shorter hospital stay.
That's a really important point that you make. I want to get back to antivirals and therapeutics, because this weekend I spoke with the chairman of the Milken Institute, Michael Milken, on Sunday Morning Futures, and he asked him for an outlook for the COVID-19 treatment and vaccine. Listen to this. Got to get your reaction.
There are more today than 400 potential treatments, whether they're antivirals, antibodies, more than 150 vaccines, and bringing those to use by the people in controlling the coronavirus.
Yeah, I want to talk to you about that, because the efforts are wide and deep. The innovation in this country is strong, but your institute has the COVID-19 treatment and vaccine tracker. Tell me about the tracker, because do you think one of the reasons that we're seeing the spikes is because we're just doing more testing and tracking, or are we actually seeing the threat that this is getting worse?
I think the answer is both, more testing, but I don't think it's getting worse. Having more people have the virus, we know better how to treat a person with the virus. The medical system is far better prepared. There are antivirals that are working. We are very excited about a few of them that are working through our medical foundations right now and in clinical trials that quite possibly can prevent the virus from going to your lungs, particularly for men. So I think we're going to treat this better. Less people are going to be in ICUs or need ventilators out of the percentage of the number of people diagnosed. But this has not gone away. But what has occurred is the greatest movement ever in history by the biomedical industry and by government.
Secretary Azar, do you agree with all of that in terms of what has taken place with the medical community, and also these antivirals and therapeutics, are they acting as a bridge until we actually do get a vaccine on the market?
Well, I absolutely agree with what Michael concluded with there. We're seeing just an historic leverage of America's biopharmaceutical powerhouse enterprise, just bringing so many potential therapeutics to study and to market. As we lead the president's Operation Warp Speed, actually one of the more difficult tasks has been prioritizing, because there are so many antiviral candidates, monoclonal antibodies, therapeutics for inflammatory response. So anti-clotting products, just so much we've had to really prioritize. And it is, as you said, a very important bridge to vaccines as we add to our toolbox. And Michael and his institute have really been key in helping us to sort through the hundreds, literally hundreds of candidates that are quite promising out there.
Secretary, when do you expect a vaccine, real quick?
We are hoping to have hundreds of millions of doses of a safe, effective vaccine, or multiple of them, by early next year, with tens of millions of doses by the fall of this year.
All right, we will leave it there. Secretary Alex Azar, great to see you this morning. Thanks very much for the info.
My pleasure.
We appreciate it. We'll see you soon.